Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, being attended to within 4 hours of going to an A&E department has been a key target for the NHS in England. But today, Jeremy Hunt, the Health Secretary, said that it should only be for urgent health problems. Speaking in the Commons, Mr Hunt said there needed to be an honest discussion with the public about the purpose of A&E departments. Here's our health correspondent, Elaine Dunkley.
Accident and emergency departments struggling to cope is a familiar story at this time of year. The NHS is under unprecedented pressure.
Secretary Jeremy Hunt.
Today, the Health Secretary, Jeremy Hunt, said hospitals on the whole are coping, but warned that high numbers of people using A&E unnecessarily was putting 4-hour waiting times in jeopardy.
It is clear we need to have an honest discussion with the public about the purpose of A&E departments. There is nowhere outside the UK that commits to all patients that we will sort out any health need within 4 hours.
Since the targets were introduced in 2000, there are nearly 9 million more visits to accident and emergency departments. NHS England says 30% of those attending shouldn't be there.
If we are going to protect our 4-hour standard, we need to be clear it is a promise to sort out all urgent health problems within 4 hours, but not all health problems, however minor.
So whilst the government warned non-emergency cases to avoid going into hospital, Labour placed the problem at the door of number 10.
This current crisis could have been averted. Hospital bosses, council leaders, patient groups, MPs from across the House urged the Chancellor to give the NHS and social care extra money in the autumn statement. Those requests fell on deaf ears, and we are now seeing the dismal consequences.
The government says it is committed to maintaining that patients are seen within the 4-hour waiting time, but they must be urgent cases. Elaine Dunkley, BBC News.
Theresa May has used her first policy speech of the year to say she wants to make government a force for good and use the opportunity of Brexit to fundamentally change Britain and create, in her words, a shared society. The Prime Minister also set out a series of measures on mental health in England as the first part of what she called real reform across every layer of society. Our political editor Laura Koonsberg has more.
6 months since she walked into the famous street. 6 months she's been Euro Prime Minister. But piecing together what Theresa May really stands for isn't always easy. But today she made clear she believes for millions life doesn't feel fair, and her government can be part of the answer.
When you see others prospering while you are not, when you try to raise your concerns but they fall on deaf ears, when you feel your very identity, all that you hold dear, is under threat, resentments grow. So our responsibility is great. It is to show that mainstream centre-ground politics can deliver the change people need.
A plain attempt to appeal to Middle England.
Right, now we're starting.
She has that ambition in common with her predecessor. But David Cameron's dream of a big society is gone. A new slogan, is it a vision? In its place.
The shared society is one that doesn't just value our individual rights, but focuses rather more on the responsibilities we have to one another. It's a society that respects the bonds that we share as a union of people and nations, the bonds of family, community, citizenship, and strong institutions. And government will step up to support and, where necessary, enforce the responsibilities we have to each other as citizens.
But although there were promises of more help for housing in weeks to come, controversial plans for schools, the only new commitments today were for mental health in England.
Are we not saying, oh, right, you're a person with a mental health problem, but actually saying, you know, come in.
Made with passion, but no extra taxpayers' cash.
For too long, mental illness has been something of a hidden injustice in our country, shrouded in a completely unacceptable stigma and dangerously disregarded as a secondary issue to physical health. Yet left unaddressed, it destroys lives, separates people from each other, and deepens the divisions within our society.
But as with all Prime Ministers, whatever they say on the steps here or anywhere else quickly rubs up with reality. But Theresa May has an extra dilemma. As she starts to manage the most complicated project any leader has faced in decades, there's a risk her government becomes simply consumed with how we leave the European Union. And her political enemies say her words ring hollow.
If only we could believe that she actually meant it. She's been part of a government now for the last 6 years, which has cut back on public expenditure, particularly savaged the NHS. And she's making these speeches about a shared society with the backdrop of people literally dying on trolleys waiting for care in our hospitals. So I think there's a credibility gap here.
It's only 6 months, but those days of summer already seem long ago. Few Prime Ministers, in the end, choose how they're remembered. Laura Kunzberg, BBC News, Westminster.
Well, as we've just heard, Theresa May has signalled a new approach on tackling mental health in England. Ministers say 3 children in every classroom are likely to be living with a mental health condition, and they have plans to help schools meet that challenge. As part of a series of reports looking at mental health for this programme, our health editor Hugh Pym has been taking a closer look at the Prime Minister's plans.
It's been nearly 2 years since Steve Mullen's son took his own life after a short and severe episode of depression.
There you go, son.
Today, visiting his grave, he could reflect on a personal campaign to get politicians to take mental health more seriously. A coroner ruled that Edward Mullen, who was 18, was let down by the system.
I stood next to my son in this church and I made him a promise, and the promise was that I would investigate his tragic and untimely end, and at the same time also investigate the whole mental health sector in this country. Like many people, I didn't know a great deal about mental health prior to this appalling tragedy, and when you look at what has happened in this country and the current state of affairs, it really is an indictment on our system. To see the Prime Minister come forward now is really quite significant and very welcome.
One of the Prime Minister's key messages is that mental health is a challenge for the whole of society and not just the NHS. That's why one of the key initiatives focuses on schools and what more they can be doing to spot problems facing pupils before they reach crisis point.
I'm seeing a Year 9 boy who's struggling with maths.
Schools like this one in Hertfordshire already employ a therapist and train sixth formers as mental health mentors, looking out for fellow students who may be struggling.
It's sort of like relationships with friends, but it's also like schoolwork.
The school has welcomed the announcement of more training of staff in mental health awareness, but says more resources are needed.
In order for other schools to pick up and do something similar to us and have in-house therapists or counsellors, there needs to be funding, especially if staff are going to be expected to identify vulnerable students. The question then is, what do you do with them once you've identified them? You need to do something with them immediately.
Whatever the Prime Minister's pronouncements, the reality is that mental health trusts in England are under serious financial pressure. Analysis by the King's Fund think tank found 40% of the 58 trusts saw budgets cut in the last financial year. 6 were cut 3 years in a row. And 63% of mental health trust leaders thought they'd miss out on the full NHS spending increases which have been pledged.
It's very worrying because we've had a number of commitments in the past around increasing spend on mental health, but that doesn't seem to be then translated into extra spending on the ground. And it's great having ministers make commitments to mental health, but if it's then not translated into extra spend, then to be frank, the commitments are worthless.
For the Mullen family, today is an important step on a journey leading towards high-quality mental health care and fewer tragic losses of life. But Steve says his campaign is far from over and there's still much more work to be done. Hugh Pym, BBC News, Cambridgeshire.
The Health Secretary Jeremy Hunt tonight spelled out the unprecedented pressures facing England's NHS, saying demand is at an all-time high and this winter has seen the busiest day in the service's history. But he denied there was a crisis, telling MPs there are serious problems at only a handful of trusts. Labour insists he needs to get a grip as across the country hospitals struggle to cope. Here's our Deputy Political Editor, Chris Shipp.
If you haven't witnessed firsthand the sort of pressures England's NHS has been under, then this patient's mobile phone footage gives us all an alarming insight. This is the Royal Blackburn Hospital around the new year. Bed after bed lined up in a corridor, patient after patient waiting to be seen.
The most sick patients will go straight into resus here. They'll come in through the ambulance.
Blackburn's medical director allowed us to film in the A&E department today.
There are actually 4 ambulance trolleys waiting now to be seen.
Busy, he admits it is, even full on some days, but the hospital, he says, is coping.
We were full by New Year's Day, and since then, so what we've been doing is we escalate then into further escalation areas. We open up our day case units and other units to take the extra patients, and then we have to put extra staff on to do that.
But Blackburn is not on what's called black alert. Other hospitals, however, are. Nottingham University Hospital's issued a black alert today because it's suffering from the most severe pressure. In Hull, routine operations are being postponed, and in a Croydon hospital, a children's ward is being used to treat adult patients. And as opposition MPs demanded an urgent injection of money, the Health Secretary hinted the 4-hour waiting target in accident and emergency may need to be looked at again.
Looking to the future, it is clear we need to have an honest discussion with the public about the purpose of A&E departments. If we are going to protect our 4-hour standard, we need to be clear it is a promise to sort out all urgent health problems within 4 hours, but not all health problems, however minor.
NHS staff deserve better. Patients deserve better. The government needs to do better. Can I urge the Health Secretary, get a grip?
Yeah. England's A&E departments had the busiest day ever on the Tuesday after Christmas, but some medics say that the pressure is coming from urgent cases, not from those with minor conditions.
We would caution the Secretary of State that actually our main problems are not with the patients with minor illness, but with the patients with major illness who require admission to hospital and which unfortunately they are not able to get.
Nevertheless, medical staff and politicians insist A&E is only for emergencies at any time of year, but particularly at this time of year.
So Chris, then, just how big a problem is the government facing over the NHS?
Well, Mary, I think unlike other areas of government policy, say trains or police or something, the NHS is an area that we all, nearly all of us, interface with every year. We all have some experience of it. Now, stories like this, therefore, can be particularly dangerous for the government. It's true to say that, you know, most people's experience of the NHS is better than their perceptions, better than their expectations. But, you know, you can't ignore statements from across the country. This one's from Leeds Teaching Hospital, talking about why they've had to cancel a number of planned operations. This one's from Croydon about why they're using a children's wards to treat adults. Even in Wales, they say performance is as bad, if not worse, as England. As for this sort of 4-hour wait time that we were just talking about, Jeremy Hunt's office insists it's all about getting people to use the right bits of the NHS, GP surgeries, 111 phone calls. But it sounded to me, Mary, like he was preparing the ground to change these 4-hour waiting targets.
OK, Chris Shipp at the House of Commons, thank you. And it is not only hospitals that are in crisis. ITV News has seen evidence of how thousands of social care patients are being failed. The Leonard Cheshire charity says councils in England are ignoring guidelines to end home visits that are so short that some patients are having to choose between getting a drink or even using the toilet. Well, our health editor Rachel Younger has this exclusive report.
I felt sorry for him when he had that mattress.
This isn't how anyone plans to grow old. John has terminal cancer. Dorothy's sight and mobility are all but gone. The little dignity they have left relies on carers getting them washed, dressed and fed. Try doing all that in 15 minutes.
Some are running in and they're doing as many three houses in an hour. Makes me cry, it makes me upset. You know, but we can't make a drink, you know, we can't make a sandwich. I can all stand up to butter bread now.
Dorothy was once a nurse at Oldham Hospital, John an engineer. They were useful then, now they feel discarded.
You just feel like nobody cares at all.
Do you feel abandoned, John?
Well, wouldn't you? There's nothing, nobody's, you've gone past your sell-by date.
Oldham Council has now moved the Fogs to a new care provider who sticks to the 30-minute minimum. Not before time, because in April 2015, the government accepted statutory guidance that said 15-minute care visits were no longer acceptable. Yet a freedom of information request from Leonard Cheshire Disability and ITV News to all 152 councils in England showed 34, that's 1 in 5, are still commissioning 15-minute visits for personal care, meaning over 16,000 people are still receiving so-called flying visits for intimate needs such as washing, dressing and eating.
For the 873,000 adults in England who rely on social care, the new guidelines were meant to offer a fresh beginning. Instead, what you get seems to rely increasingly on where you live or what you can afford, rather than on what you actually need.
In London, this stroke survivor, who wants to remain anonymous, says her visits are often cut to just 15 minutes, and on 2 days last month, she didn't get one at all.
I couldn't get up and get dressed and eat and drink, other than any drinks that I happened to have by my bed. I can't really get to the lavatory on my own, and as each day progressed, I got weaker and weaker because I wasn't eating.
Many charities believe the lack of resources is a scandal.
People are having to make choices. Do you go to the loo or do you eat or drink? I mean, that's a choice that nobody in the United Kingdom should have to face.
Yet right now, in homes across England, some of the most vulnerable continue to receive the least dignity.
I mean, it really is horrifying, isn't it, Rachel? You spoke to the Health Secretary about this. What did he say?
Well, he seemed genuinely shocked by these figures because there's been widespread acceptance that this is no way to deliver compassionate care, but also because I think that he, better than anyone, understands the impact failings in social care have on our already overstretched hospitals.
Well, it makes me very angry because, how can you possibly look after someone's entire care needs in just 15 minutes? When you look at the pressure in our hospitals caused by some of those people then ending up in A&E departments, which frankly are the worst possible place if you're old and if you're confused, if you've got a condition like dementia, you don't want to be in a busy A&E department. And if we could look after you better at home or indeed in a care home, that is a much better place for you to be. I don't want to pretend it's easy, but we must not compromise on giving decent, basic care to people who need it.
You believe some are failing in terms of management rather than funding?
Some could be doing better, but I don't want to pretend that there isn't pressure faced by everyone. And if we look at what the best places are managing to do, they're having no delayed transfers out of hospitals. They are giving good social care packages. There are Labour councils and Conservative councils that are increasing funding for social care, increasing the number of people who are getting supported by the social care system. And we need all authorities to be following their example.
OK, but just to pick up on that, did he not recently announce that he had given councils permission to raise more cash for this?
Yeah, that's right. And in fact, it was interesting that he chose to point the finger at some local authorities, suggesting they need to pull their socks up. And that's because although every local authority is able to raise council tax by 3% to help pay for its social care, that delivers a lot more money in places like the home counties, where property prices are more expensive, than it does in places like Oldham. And our research found that there is a correlation between those areas able to raise the least money and those who are now having to resort back to 15-minute visits. And just to put this into context, the head of NHS England, Simon Stevens, has made it clear that even if the worst performing local authorities are able to match the performance of the very best councils, even then, he says, there is still a need for extra funding to be given to social care in England.
OK. All right, Rachel, will you stay with us? We're going to talk a little bit more in a minute or two. But in the meantime, earlier, Theresa May set out her plans to improve the treatment of mental health sufferers and combat the stigma that they often face. The Prime Minister pledged that by 2021, no child would have to travel away from their local area for treatment. But as our national editor, Allegra Stratton, reports, little new money was actually promised.
Since Ollie was 9, he's had mental health problems.
I was going mad inside, literally. It was like being inside a prison in your head not long ago.
He wasn't diagnosed until some 15 years later. In that period, he tried to take his life 4 times.
Then that was the best thing to do in my eyes, and I was a burden to everyone else.
Today, the Prime Minister unveiled new support for mental health, with a special emphasis on young people like Ollie.
The burning injustice of mental health and inadequate treatment that demands a new approach from government and society as a whole. This starts with ensuring that children and teenagers get the help and support they need and deserve. because we know that mental illness too often starts in childhood, and that when left untreated, it can blight lives and become entrenched.
As part of the changes, the Care Quality Commission will lead a major review of children and adolescent mental health services in England. Mental health first aid training will be offered to secondary schools. There will also be new trials to strengthen links between schools and local NHS mental health staff. Theresa May today pledged the mental health budget would be monitored to stop raiding by the cash-strapped NHS, but she added little new money to the pot.
Essentially, without additional funding, we are talking about changes at the fringe. We're not talking about the substantive change that the Prime Minister has promised.
Many wanted new money as well as new policies.
When you're losing the will to live, you don't want to be waiting then to be put to the wrong person or them persons to not have the funding for you, you know?
And did that happen to you?
Yeah, that's happened to me, yeah. I've still not had any therapy yet.
But perhaps today another step taken to stop future young adults going undiagnosed. Allegra Stratton, ITV News.
So whether it's mental health, social care or NHS hospitals, it is all about money, isn't it? And is there any more going to be coming anytime soon?
Well, much of it does come down to money, and whether you're talking about Jeremy Hunt, who was today saying that he would try and provide more care beds so that people could be discharged out of hospital, or whether it's Theresa May promising to improve child mental health services, there is no new money coming at the moment from the Treasury, and there is already a challenge getting some money that isn't ring-fenced to where it's needed to go. For example, the government promised £1.4 billion for children and adolescent mental health service. There are concerns it isn't getting to the front line because many hospital trusts are facing deficits of millions of pounds that they're having to plug. So while it is fantastic and promising to see the Prime Minister championing mental health, there are questions over whether she understands yet the real crisis in social care in particular, where the three leading health think tanks in this country think that by next year, the gap between what's available for social care and what we actually need is reaching £1.9 billion.
Terrifying, isn't it, Rachel? Thank you very much indeed.
Ministers from Theresa May downwards have denied that England is facing a humanitarian crisis in the NHS. The unprecedented claim from the Red Cross persuaded the Health Secretary to appear today before MPs, telling them that hospitals will be able to take action, including warning non-urgent cases over the 4-hour A&E waiting limit and cancelling outpatient appointments to help cope with growing demand over the winter. Our health and social care correspondent Victoria MacDonald has this.
Just after lunch today, Nottingham University Hospital Trust declared a black alert, a message to staff and community teams: more beds needed. Hull Royal Infirmary postponed operations today, saying its beds were full. Princess Alexandra and Harlow declared a level 4 alert, the highest they can go. This was meant to be a day about mental health, with a major announcement from the Prime Minister. Instead, the Health Secretary had to come to the Commons this afternoon to answer questions on winter pressures. He insisted it was just a few trusts in trouble, but he did issue a warning over the 4-hour A&E target.
This government is committed to maintaining and delivering that vital 4-hour commitment to patients. But since it was announced in 2000, there are nearly 9 million more visits to our A&Es, up to 30% of whom NHS England estimate do not need to be there, and the tide is continuing to rise. So if we are going to protect our 4-hour standard, we need to be clear it is a promise to sort out all urgent health problems within 4 hours, but not all health problems, however minor.
This caused surprise and was taken at first to mean that Mr Hunt was downgrading the target. The Department of Health was forced into clarifying it, saying it meant instead that more needs to be done to divert the patients who don't need to be there.
I think if he was to acknowledge the crisis, people would respect that and start to work with him. But until he acknowledges that there's a real problem, we're not going to be able to take things forward and make things better for the patients, because they're the ones who are suffering.
The mental health announcement brought a welcome focus on children and adolescent services, including training for secondary schools.
There is no escaping the fact that people with mental health problems are still not treated the same as if they have a physical ailment, or the fact that all of us, government, employers, schools, charities, need to do more to support all of our mental well-being.
And yet the question was, where is the money? Tricky on a day when NHS finances were under such scrutiny. This mother, Rachel, watched the Prime Minister's speech somewhat in despair. We can't identify her or her daughter. She told us of the battle to get urgent inpatient care for her 17-year-old who was suffering from anorexia.
She says there aren't any easy answers, but there was quite clearly a contributing cause to this crisis that we're in, and that is a massive, massive underfunding of all children's services, and particular CAM services, during the last government and during her government.
And she feels it acutely. Her daughter was finally found a bed in Scotland, 300 miles from their home.
It's devastating, it really is. You know, all the time you just feel like there's a part of you missing. And if she was more local, I'd be able to go and see her, wouldn't I, and pop in and see her and give her a hug. I can't do that. We have to plan this, we have to book our flights. I'm going up on Thursday and staying overnight Friday, but then I've got my other two girls that also need me at home that are worried and are unhappy that I'm not going to be here. I'm being pulled in all these different directions. It's just really, really hard. And I hope Theresa May's listening and Jeremy Hunt are listening, because this has to stop, because it's destroying people like us and our families.
The government did pledge more money for children's mental health 2 years ago, but it hasn't always reached its intended target.
Just having the Prime Minister stating that this is her priority will make people focus and make commissioners focus on where they're spending their funds, and make the NHS bosses recognise that this is important. They can't just ignore children and young people's mental health again, because it has been ignored for too many years. But the trouble is, it's a long way from what the Prime Minister is saying to the frontline services. And in reality, there is no additional funding that has been promised here.
The Health Secretary has now put himself in charge of mental health and declared his commitment to improving services. But for the moment, his attention is repeatedly diverted by the seemingly relentless pressures on England's hospitals.
Victoria MacDonald reporting. Well, now, one of the hospitals that has come under the most severe strain in recent weeks has been the Queen's Medical Centre in Nottingham. Our correspondent, Kami Nzerim, is there now. Kami.
That's right, John. As Victoria described, the picture here in Nottingham really is one of a system that is being stretched to its limits. The hospital put out a tweet today, a public tweet, a public message urging people not to come to A&E unless it was absolutely necessary. They had some numbers, some figures to support that request, that argument. They said that there were already 132 people waiting to be seen, and that many of them were having to wait in excess of the 4-hour target, the 4-hour target for A&E services. This data was supported by recent figures put out by the local ambulance service. They said that over the New Year period, they'd received double the number of calls that they would normally expect to receive, calls that pertain to potentially life-threatening conditions. So where does this leave us? Well, the Trust said they are still on black alert, and they are reaching out to local partners, local health partners, late-night services, out-of-hours services, local GPs to step in and try and help them take up some of the slack. But this isn't just the picture here. It is really redolent of the situation in many parts of the country.
Kami Nzerim. Well, the health service, in particular support for those suffering mental health problems, was at the centre of the Prime Minister's first big speech of 2017 this morning. It was part of Theresa May's vision of what she calls a shared society, tackling injustices which leave many ordinary families feeling they're being left behind by the rich and powerful. Here's our political editor, Gary Gibbon.
Prime Minister, is there a crisis in the health service?
Theresa May promised her government would put mental health issues at the heart of its work, rethinking how government helps at every stage of life.
What I'm announcing are the first steps in our plan to transform the way we deal with mental health problems at every stage of a person's life, not in our hospitals, but in our classrooms, at work, and in our communities.
The Prime Minister announced a programme of training for schools to spot pupils suffering anxiety, depression, a review of mental health in the workplace, including a look at discrimination laws to protect those facing disciplinary action or job loss, and an expansion of online therapy treatment. Under David Cameron, the government injected an extra £1 billion of spending into mental health, but many NHS bosses have been grabbing that money to plug holes in other health services. Mrs May said she'd hold those managers to account.
Are you actually really going to forcibly ring-fence that? Surely you accept they're only doing that because they're desperate to deal with issues of physical health.
Obviously, we recognise the pressures that the NHS has been under over the winter. This is not unusual. There are always extra pressures for the NHS over the winter period. But if you look at what has happened in terms of funding for the NHS, of course, we have put that extra funding into the NHS.
So, no indications of extra money for the NHS today. Several in the audience noted strong echoes of the speech David Cameron gave as Prime Minister almost a year ago to the day.
Up to 1 in 4 of us.
1 in 4 of us has a common mental disorder at any one time.
Breaking the mental health taboo.
Breaking the stigma.
I believe we can lead a revolution
to transform our approach to mental health
in Britain.
Did you spot any differences with David Cameron's speech in this one?
Well, I think the Prime Minister, two Prime Ministers have spoken about mental health. They put it in a wider context of wider social injustice or the big society, however it may be described. And I think the approaches have some similarities. However, I detected in this Prime Minister an intention to put mental health right at the heart of policy making.
I think Theresa May is very nervous about taking on the huge costs that are going to be involved to give any parity between physical and mental illness.
And can you do anything if you don't do that? Can you really achieve anything?
You can't take away the kind of suffering we come across all the time.
Mrs May repeated her analysis that the referendum result last summer was in part a cry of pain from working-class families struggling with household finances, often not on any benefits. Now susceptible, she thought, to far-right or hard-left messages, thanks to the negligence of her predecessors in office.
We see those fringe voices gaining prominence in some countries across Europe today. Voices from the hard left and the far right, stepping forward and sensing that this is their time. But they stand on the shoulders of mainstream politicians who've allowed unfairness and division to grow by ignoring the legitimate concerns of ordinary people for too long.
Theresa May said she wanted to stop people feeling locked out and left behind. She said government under her would go further to help them. And she called this the shared society.
And Gary Gibbon joins us live now from Westminster. Gary, what is the shared society?
Well, we've got a probably clearer idea today of exactly who Theresa May is aiming the shared society plan at, and that's the people she said there who are just above benefit level, although I suspect from her description of them, quite a few of them would have got tax credits in the past. As for the actual shape of this bolder, more innovative state that steps up to help with solutions, no, I think I'd be lying if I said we got a really clear picture of that. I asked her just after the speech if it would, under her plans, be a bigger state, and she said it would be a more strategic state. And over the years I've come to see that as the answer that people give if they want a state that's about the same size or smaller. We do know, though, that she's very proud of her time in the Home Office, reducing, as she's told people, the police budget, and yet she would say getting more from less, lower crime. So I wouldn't be expecting much cash bonanza.
Just to move on to another topic, though, the pound took a dive today. Well, what's her view of that?
She was asked about that as well, and she said that she thought what had happened is that reporters talking about hard Brexit after her interview on Sunday television, that they had contributed to the problem that had made traders run away from the pound. Well, I think what you've got to say to that is what we know about the general direction of travel of the Brexit plan, almost certainly out of the single market as we know it, out of the customs union as we know it. Traders are entitled to think that that is one definition of hard Brexit, and I think if we're heading in that direction, we may get the pound may get a few more days like today.
Thanks, Gary.
Well, I've been speaking with the Health Secretary, Jeremy Hunt, and I began by asking him whether today's announcement would simply reverse government cuts to mental health funding from the last 5 years.
I think there have been cuts in parts of the NHS in mental health over many years because it's sort of been the poor relation. And sometimes when people have been short of money in a particular part of the NHS, they've raided the mental health budget And that has got to stop. And Theresa May is signalling today that mental health is going to be one of the big priorities, if not the big priority for the NHS. But actually over the last 5 years, the number of people getting mental health treatment in the NHS has gone up by about 1,400 a day. Where we're not good is children's mental health. And we think that about 3 children in every classroom have a diagnosable mental health condition, and we're only helping a quarter of them, and that is not acceptable.
This crisis has been developing all the period of 4.5 years that you've been Secretary of State, and nothing's been done.
Well, I accept, and that's why I'm saying today that we haven't done as well as we should for children. We've done a lot in many other areas of mental health, but now we need to do children. And when it comes to children, although there has been some improvement in provision, we think that the biggest area that we need to focus on is schools, because it's partly about what the NHS provides, but it's also partly about spotting problems earlier, and schools can help us do that.
But the fact is that there's evidence that even monies that were targeted and plans that were targeted for mental health, in the end, got spent on other things, mainly acute physical problems.
Well, I think that has been a structural problem in the NHS for many years, because you have...
Yeah, but how do you stop money and effort that you're putting into mental health being diverted to crises in physical health?
Firstly, by what we're announcing today. This is making clear that it's not just a priority of the Health Secretary, it's a priority of the Prime Minister to sort this out. But secondly, this year we've become the first country in the world to publish Ofsted-style rankings of the performance of mental health provision for every area of the country. So the areas that do raise their mental health budget to put them into their local hospital will be called out for it.
In a sense, isn't there a danger that in looking at the mental health system, and you've been very candid about how broken it has been, essentially describes the state of the National Health Service itself? And after all, it is the Red Cross who have said it is a humanitarian crisis.
Well, I don't accept what the Red Cross have said, but, you know, I'm a politician, so maybe we should look at what independent people are saying about this. Chris Hobson, who represents...
Well, who's independent? The Red Cross are pretty independent, aren't they? Well, except that you depend upon them to get people home from hospital.
But let's look at, and we pay them to do that, by the way, but let's look at what other independent people are saying, like the people who represent all the hospitals in the NHS who have been strong critics of aspects of government policy.
Why not look at what the Red Cross is saying? Because after all, the Red Cross is something which is a constant in everybody's town and village. They all know about the British Red Cross. And if the British Red Cross is telling them there's a crisis, we ought possibly to take some note of it.
Yes, but we also have to look at what other independent people are saying, and what the people who actually represent the hospitals are saying is that we have very severe problems in a small number of hospitals, which no one is trying to underestimate. But the vast majority of hospitals are actually coping slightly better than this time last year.
There were hospitals in Britain that had to shut their doors because they reached 100%.
It failed in some hospitals, and we've had some very serious problems in those.
2 people died on trolleys in Worcester. I mean, the investigation started on Friday. This is happening now.
Well, Worcestershire is probably the hospital which we're most worried about of all, because what happened there was very serious. But I just think it's wrong for people watching this programme to think that this is a generalised picture, because actually what's happening in most hospitals is the pressure is extreme. They've never worked harder. They are doing an incredible job, but actually they are managing to cope.
As mental health is the focus, let's have a final question on how soon will you see a significant, visible change in the treatment of young people in the mental health service of the NHS?
Well, that's a kind of good question that I'd expect you to put to me. So let me give you...
And you're going to spend some time trying to think what the answer is.
I want to give you a decent reply. It takes time to train up people. So if we want to improve the provision in every single secondary school, 4,000 secondary schools, it takes time. I would be very disappointed if there wasn't a visible improvement by the time we go to the country at the next election.
Health Secretary Jeremy Hunt talking to me earlier.
Well, I'm joined now by Jessica Britton-George, a junior A&E doctor who works in a North London hospital. So Jeremy Hunt there says he doesn't want people to get the sense that this is a generalised problem, that the crisis is widespread. What's your experience?
I think it's been a long time since Jeremy has been in an A&E recently. Almost everyone I know, so obviously working in A&E, you get to know lots of people in your speciality. We're cracking under the pressure. There are a lot of people in hospitals. There are a lot of filled beds with people who can't get home, and there is no space. And he talks about the increased burden on the health service, which I would agree with. There are many reasons why we have more people coming through the doors, but that doesn't change the fact that we're breaching our targets. We're giving people the care that we don't want to give them, like they were saying about Worcester, and we're letting people down.
Have you got a political axe to grind? Some people think junior doctors trying to bring down the government.
Yeah, I'm a renegade, actually. I'm always trying to topple governments in my spare time. No, I haven't. I mean, I think every political party that's ever been in power in this country, or indeed in any country, will find themselves fighting with people who are providing free healthcare. And I think that's the biggest problem here. We're providing free healthcare to something that I would say this government feel could be very easily monetised.
So give us a sense of the weights in your A&E and the people on trolleys and, you know, the acuteness of it.
So I'm absolutely blessed that I'm on a week off this week. But last week, for example, we had 16 or 17 patients in our corridor. Not in our corridor just because they come off an ambulance, in our corridor because they needed treatment and they needed antibiotics.
And that's unusual, is it?
That is unusual. I mean, so I've been working in A&E for about 2 years now, most of the time in London, and I did some in Wales as well. And we always manage, through the beauty of bed managers and excellently trained nurses, to reshuffle beds and find people who possibly could go home at 11 o'clock at night. And at the moment, we just can't find that capacity.
And is this just a January thing? I mean, do you think if we wait a couple of weeks, it'll all calm down again? Or?
It's so difficult to predict. So last year, our winter crisis was lengthy. Crisis being quite a difficult term, but the burden was lengthy, and it was cold weather, and it was people being more poorly. And we have quite an ageing population, and you know that's going to continue for as long as we manage to keep people alive. So I don't think saying that we can brush this off as, oh, January will be awful because everyone was holding on for Christmas, but February will be fine. I don't think that's a good way to plan for our healthcare system.
Now, Jeremy Hunt today said 30% or up to 30% of people going to A&E don't need to be there, and they won't be counted anymore in this 4-hour waiting target. Would you agree it's about 3 out of 10 people who shouldn't be there? And what do you think about this moving of the target?
So it's quite difficult. I never thought I'd find myself saying that I agree with the Health Secretary, but in this I do. I don't think that using the 4-hour target for people who don't need to be in A&E is a good idea. I would love to know how he defines his 30% of people who don't need to be in A&E. There are a lot of ways to do it, through our triage system, through the people that are very experienced nurses at the front door send away. The people that are very experienced nurses send to the GP because they know they don't need to be seen in A&E. But as a clinician, I would find it hard to say this is the absolute 30% that don't belong here. So I'm not sure how somebody who's a politician can make that definition.
Jessica Britton-George, thank you very much indeed. John. So the Prime Minister has kicked off the new year with a new slogan, the Shared Society, designed to create fairer opportunity and tackle long-standing injustices. She identifies mental health care as one of these, saying that mental health has been dangerously disregarded as secondary to physical health. Theresa May wants to transform attitudes, focusing on mental care for children and young people and giving extra training to teachers.
The heart of the plan is a commitment to building a fairer society and tackling the burning injustices that have been allowed to stand for too long. And I want to turn to one of those burning injustices in particular. The burning injustice of mental health and inadequate treatment that demands a new approach from government and society as a whole. Let me be clear. Mental health problems affect people of all ages and all backgrounds. And an estimated 1 in 4 of us has a common mental disorder at any one time.
Well, I'm joined now by 2 people who've both written about their own mental health issues, as well as Prime Minister's big ideas. Alistair Campbell was Tony Blair's press secretary and communications director. He's suffered from depression, is now a leading proponent of the mental health anti-stigma campaign, Time to Change. And Isabel Hardman has recently returned to her role as assistant editor of The Spectator after being treated for anxiety and depression. Alistair Campbell, do you see what this shared society adds up to and how it can help mental health?
Well, I would if there was a real commitment to it and to the policies that ought to flow from it. But it's the same as with David Cameron's Big Society. These were both, it seems to me, speeches where they felt they had to have a top line, But then when you, and I welcome the fact that she is talking about mental health, just as I welcomed a year ago when David Cameron made a very, very similar speech. But the reality is that you can talk all you want about a shared society, but in the last 5 years, funding for mental health services has been cut by 8%. We have 6,000 fewer mental health nurses. We have fewer beds per head of population than all the other major European countries. And my big worry about the speech that she made today is that she and other politicians are hoping that the anti-stigma campaign, which can lead to an improvement in attitudes, is not to accompany the services that we need to go alongside that, but actually as a substitute for that. And I really genuinely worry that the thing I really didn't like in her speech, where she talked about it, yes, it's not just about money. I agree it's not just about money, but the piece she wrote in the Sunday Telegraph yesterday, the sense I got was they're basically saying the stigma is more important than the services. Yeah. Now, the stigma is important, and we have to work at breaking that down. But the services are fundamental, and at the moment, they're not there.
Isabel Hardman, I mean, do you think she sort of crowbarred the mental health issue into what was supposed to be a big idea?
No, I think mental health has been an interest of Theresa May's for a long time. And like Alistair, I'm quite unimpressed with the sort of ambition that was set out in her speech, which was largely encouraging employers and schools to do more on mental health and then allocating a tiny pot of money from the government to improve support. But in the Home Office, she did actually improve the treatment of mentally ill people who end up in police cells, which was something that she saw as a massive injustice.
So did everyone else, to be fair. I mean, the police refused to do it, really, didn't
Well,
they?
she was the one who banned it, though, to be fair, and that's something that her allies always cite as a sign that she's serious about getting things done. But we need to see so much more than what we heard today before mental health is anywhere near equal in terms of its treatment to physical health.
I mean, if you look at the shared society as a big idea, do you understand what it is? I mean, isn't it just, let's make everything better? Or...
Yeah, I think it's a almost sort of Gordon Brown-esque rebranding exercise saying, I'm not like my predecessor. So David Cameron had the big society, and that was a rebranding from Margaret Thatcher talking about no such thing as society. She's saying, well, I've got the shared society, which is just so much different. But actually, in her Sunday Telegraph article and in her speech today, she talked about a commitment to fairness and respect for institutions. I mean, even Jeremy Corbyn agrees with those things. I don't really see what the great difference is in her vision.
Alistair Campbell, is there anything to disagree with about the shared society?
No, because in the end, it's all about the policies that flow from that. If you know, I've watched the whole of your programme tonight. If you want a shared society, then you have to address the problems of inequality that you see, where some people are sort of, shelling out £250,000 for a new car and driving past hundreds of people who are living on the streets. And I just thought, Isabel said there that there was a lack of ambition in that speech today. There's one bit in the speech that really jumped out at me. She said by 2021, no child will be sent away from their home area for mental health treatment. 2021. You had an interview earlier with a mother who is having to cope with long trips to see her daughter being treated for a mental health problem, and she's saying that it's going to take 4 years before we stop that. And I think the other thing that's at play here is that Theresa May, no fault of hers in the circumstances that she became Prime Minister, she's become the Prime Minister at the time of Brexit, and I think Brexit actually is consuming her, is consuming the government, and they don't have the time and the commitment to focus on these issues. And all I'm saying is that David Cameron made this speech a year ago. She mentioned mental health on the steps of Downing Street 6 months ago. Yes, she's made a speech, but a speech is not good enough unless it's backed up by the action that flows from that. Yeah. And it's not going to be met by giving £10 million to think ahead to train a few social
Isabel
workers.
Hardman,
great though that is.
If Brexit, has framed this, doesn't it also box her in that it really limits her ability to extend the state?
Well, and it's also a convenient excuse, isn't it? So David Cameron didn't really get underway with his big society project because of the coalition and the economic crisis. But actually, if you look at a useful model for Theresa May, could be Clement Attlee, who had plenty of excuses not to do anything, leading a post-war government, but managed to set up the NHS and the welfare state. So politicians always have excuses not to do big radical things. But actually, if a Prime Minister who was leading an effectively bankrupt country was able to do what he did after the Second World War, surely Theresa May doesn't need to come up with excuses to do a few big things on mental health.
So she could, is what you're saying?
Well, she could if she wants to.
The question is, do you believe it's really a big idea? Or is this just a grope?
I think she's trying to set out what we didn't have in the Tory leadership contest. And I do think she believes that there is an injustice in the treatment of mental health. But she, as we've said, she needs to be much more ambitious and actually put money there, because this is one area that really needs money.
Just briefly, Alistair Campbell, we've got 30 seconds. Does it sound like a big idea to you?
No, it doesn't. It sounds like the top line for a speech and a few issues that she's throwing together. I completely agree with Isabel. Clement Attlee is a great example of somebody who, Prime Ministers can and should do big things. This was not an ambitious speech.
Alistair Campbell, Isabel Hardman, thank you both very much indeed.
I've been getting